Coming up on this episode of Discover Health Podcast.
One of the things that I talk about so often is killing the bug. It does not solve the problem. And I think that so often people are under the misconception that their only issue is just the bug and that's it. But you've already mentioned so many other factors that could be at play. In your opinion, when someone does go a traditional route and maybe does antibiotics or maybe does it could be a natural protocol, but like you said, they use herbs to guns ablaze and go kill the bug. What things can happen and what are the shortfalls of an approach like that?
When you expose Lyme to certain antibiotics, it produced like little dormant stealth forms called cysts. It also produced things, slimy shields called biofilms to hide in. And that makes it much more resistant, like sometimes 100 times more resistant to antibiotics, the immune system, things like that.
Welcome to the Discover Health Podcast, where we explore the power of gut health, nutrition, and lifestyle to help you feel your best every day. I'm Dr. Josh Sharp, your guide on this journey to better digestion, more energy, and overall well-being. Ready to start discovering? Let's hit the trail. Welcome back to another episode of Discover Health Podcast. I'm your host, Dr. Joshua Sharp, and joining me today is Greg Lee. Greg is the founder of the Lyme Research and Healing Center in Frederick, Maryland, and he's the creator of the Goodbye Lyme system, which is a cutting-edge approach for stopping persistent Lyme disease and chronic infections. He's a former NASA systems engineer who worked on projects like the Hubble Space Telescope and the International Space Station. He now uses Chinese herbal medicine, advanced diagnostic scanning, and innovative detox and antimicrobial therapies to help chronically ill patients resolve root causes when conventional medicine has failed. Greg, thank you so much for joining me today.
Awesome. Thank you for being here. Thanks. I love being on live here, you love your energy. So let's dive in.
Well, first of all, it's been so exciting getting to know you just in the few minutes that I've known you, hearing a little bit about the work that you're doing. I love learning things from other practitioners, things that you have learned in your sphere of influence in your world that maybe I haven't learned. And so I love learning these things, what's working for other practitioners. This is fantastic. And so I'm so excited to get into that. But before we get into that, I want to ask you, how does someone go from working as an engineer to working with clients, working with people that are dealing with chronic illness like Lyme disease? How do you make that transition?
A lot of ways, engineering, when people are trained in that, that really accelerates medicine because you have systems understanding, you have critical thinking skills. You're not just treating a surface level symptom, but you're kind of doing a deep dive analysis into like, hey, what's the core issues here that are causing the surface symptoms or other kinds of presentation. So for me, it was like a no-brainer. It's just like, oh, this is just a different system. It's not a robot. It's not a space station. It's not a satellite. It's a person.
That's great.
So
what were the driving factors? Would they have like a career day at the NASA lunchroom, or what happened? Why did you change direction there?
I was a manager in a robotics lab, and we were working with astronauts on orbit, and they were controlling robots in the lab. And when you have little windows, because their schedule's like booked, so we had a window at like 3 a.m. in the morning. So we were preparing for the experiment. We ran the experiment. They controlled the robots. It did all sorts of things because we want to do the reverse, like control robots from the ground to build the space station or maintain it. And then we analyze the results, and, that's like a 24-hour process. And having those multiple times was a lot for my system. I began to get gut issues and bloating, cramping, bowel urgency, pain. And so I went to the doctor, and he goes, "Oh, you got irritable bowel syndrome." And I was like, "Okay, well, great." And he goes, "Here's a medication, take that." So I did, and it made me really brain foggy, and it didn't help my gut at all. And I was like, it really just totally rocked me. And I was like, this isn't helping at all. Oh my gosh. And I started to have insomnia, anxiety, and, more worse gut issues. And I was freaking out. I was like, no, and fortunately, a colleague of mine goes, why don't you try acupuncture? And I'm like, I had this crazy uncle, and he used to work for what used to be but before the CIA was the CIA, he worked for that organization. And so it was OSS. And he would take bees and sting his arthritic joints. And I thought he was nuts because, as a kid, you like get stung by a bee, you're like, ah, I don't want that. But now I'm dealing with my own health issue. I'm like, well, maybe he wasn't so nuts. And, it's kind of in the bloodline of putting needles in our body to heal. And so I went to an acupuncturist and she goes, well, let's look at your diet. And what are you eating? So, and, basically it was like, they're very inflammatory processed, wheat, sugar, dairy, all these things that make irritable bowel syndrome worse. And I was like, well, why don't you change that? She was very kind about it. And I was just like, okay, I get it. And then she got the treatments helped. I took remedies. And over the course of several months, I noticed that things got better and better and better until I got to a point where it's like, hey, I very little left. I'm so grateful, and went back to work, didn't think anything of it. A year later, the symptoms came back, and I was like, no. And I just said, oh, I can't, it's too stressful. Or I put on my, whatever it is. And so I decided I needed to make a change. And it hit me to go help other people to heal like my acupuncturist helped me. So, hey, acupuncture school right there, right up the road. I studied that and herbal medicine. And over the past 3 decades, I've been helping patients with natural remedies and treatments to overcome their Lyme and co-infections, mold, EBV, parasites, and so on. So that's kind of like in a nutshell.
That's great. Now, I think I remember reading that you had a family member that had a tick-borne illness. Can you tell me about that situation?
So I had a family member who had an attached tick. And so at that point, I knew enough get the tick tested. So we sent it down to Klongen Labs, which is here in Maryland, and it tested positive for Bartonella. And we're like, oh man, Bartonella. So I talked to her pediatrician who was Lyme aware. And so she prescribed rifampin and one other antibiotic. And so I had her also take capsule herbs and supplements, and within several months the symptoms, the rash, the stuff went away. So we used that to say, okay, tick checks every day if we go out, because unfortunately in Maryland there's a lot of ticks here, and you can just sit on a park bench, and they crawl up on the park benches in some places, and people have no idea, or their dog, brings it home and it jumps off of the dog onto the person. So we see a lot of people who have no clue how they got bit by a tick or how they got Lyme.
I think that happens so often, and I know in my experience, the having the classic bullseye rash, I mean, that's not the majority. That's the minority of people that actually remember the bite or I guess technically a sting, but they remember the tick. They remember seeing a rash in the area, and then symptoms started afterward. The vast majority, from my experience, and yours, I don't know if yours is the same, they have no idea, and they just all of a sudden crashed out. Is that how you found things too?
Oh yeah, that's the majority definitely of our patients. They have no clue, or they all of a sudden they have a strange symptom. They get tested for it, and it's like, what, Lyme? So
Yeah. One question I want to ask you is, I feel like some people can, get the bullseye rash, they get a little sick, and they seemingly get well and go back to normal, and life is fine. And another person gets the tick bite, gets the rash, or doesn't, and weeks or months later they crash with illness, brain fog, and extreme fatigue, and this goes on for years and years and years. In your opinion, why do you think some people seem to do so well and have very little lingering effects, and other people it lingers on for years and years?
What we see in the kind of patients that have the lingering infection or the crashing ones, they often have like genetic mutations in something called the human leukocyte antigen genes or methylation genes, which basically say they can't detoxify the toxin from the infections very well. So the toxins then accumulate and it makes them sicker and sicker and sicker. And then eventually they hit a point where they crash, or they have mold toxic exposure and could be in a workplace, a home, a car, and those toxins are airborne. You can't see them, you can't always smell them, and they can really just be breathed in, they can be absorbed through the skin. And we see patients like they'll say like, well, my first symptom was I was just feeling more anxious, or I started to have like panic attacks, or and I'm not a that isn't normal for me. So it's this sudden or like slow onset of toxins exposure that often we see. Other areas that they have, other patients have, like blocked detoxification pathways, so they
Mhm.
can't get things out their liver or their gut, and so those are kind of like some of the main issues that we see that why people crash.
So there's factors under the surface there that are making them more susceptible to struggling with this for a longer period of time. In my opinion, I feel like not only is the awareness of Lyme increasing, which is kind of a good thing in many ways, but I also feel like the incidence is going up, and I don't think it's just because of the awareness. I think more and more and more people are getting Lyme and struggling with Lyme. In your opinion, what factors do you think are at play there, and why do you think it's becoming more rampant?
Well, ticks are small, they're tiny, and people have no clue they've been bit because they're the size of a period on a sentence. And a lot of warming in the environment, ticks don't get killed off by the cooler temperatures as much. So you have more being born. Like one black-legged deer tick can lay like 3,000 eggs. That's like a huge, like,
That's a lot of yeah.
exponential growth over one season. So it's and deer they kind of adapt to living in suburbia, and they go through the neighborhoods and they spread the ticks. And birds also, migratory birds, they take the ticks from South America and bring them up to North America. North America take the ticks, take them down to South America. So we have lots of animal taxis that unfortunately are spreading the ticks.
Thank you, birds. Very, very thankful for the birds.
I love birds, but I don't
Yeah,
like ticks.
nice to look at, but leave your ticks, somewhere else, please,
At the
if you
border.
would.
Yeah.
So, personally, I think this is just my opinion, and you can tell me I'm crazy or whatever, but I also feel like, and some of the factors that you mentioned before, why someone would struggle with getting an infection and then it stays around chronically are toxicity. Detox pathways are clogged up. We've got so many gut issues. For me personally, I feel like the health of the nation is worse. We're sicker than ever. We're more toxic than ever, and I feel we're more stressed out. And so I feel like we're also setting ourselves up. Are those factors, do you think, that are really important, or do you think it's more so just ticks are reproducing at such high levels and we're not having the die off?
Yeah, it's a combination of multiple factors. People are more stressed. Also, if they have like hidden trauma, that can also keep the immune system in fight or flight,
Mhm.
and it can't relax and heal as well. So, a lot of that we see in our patients, as they begin to detox and get better, then it can surface like, history of like trauma or surgery or car accidents, things like that, traumatic brain injuries, that we need to address those things to help deepen the healing and continue helping the patient.
Yeah. In talking with you, I kind of explained my theory. I think there's a lot of people walking around with Lyme that don't have any idea. They are unaware of what's going on inside of their body, but they've got it and it's in there. In your opinion, what are some of the symptoms and what are some of the signs that people could have an infection like Lyme or one of the co-infections that they could be maybe even be misdiagnosed with? But what are some of the things that they should definitely not ignore and that they should really consider Lyme as a possibility?
The early symptoms that patients talk about is like, I have a joint that swells, like their knee
Mhm.
blows up like a softball. And the doctors around here who've treated enough Lyme patients, they don't even need to aspirate. They go like, you probably have Lyme. Or patients with chronic fatigue symptoms, or brain fog, or believe it or not, gut issues. We also see a subset of patients with uh, urinary tract infections that have from tick infections or interstitial cystitis, and other patients that have severe menstrual symptom flares like premenstrual or during menses. That's also maybe an indicator that there may be an underlying tick-borne infection in there.
Yeah, I agree, and I think there's just a variety of factors there. What are some of the conditions that people might be diagnosed with? I want to touch on one other thing that you said too. I'm going to try not to forget. But well, let me ask this first because I'll forget if I don't say it. In our area, and I know you said in your area, you're in the Northeast United States, Maryland, and people are aware. They're a lot more aware. Lyme disease is much more commonly treated. It's more commonly diagnosed there, but even where we're at, where we've got lots of Lyme now, there's still tons of doctors that it's not even on their radar. And it's so hard to get them to even run any kind of test for it. And you mentioned like, oh, their knee bloats up and swells and just randomly nothing happened. And you said it's pretty common they would be diagnosed with, oh, yeah, you got Lyme and let's work on that. If that happened in Missouri, if that happened in so many other states, I think the very first thing that a practitioner would do, and I've seen this happen, is, oh, well, let's give you a cortisone shot in there, or let's give you some type of steroid to kind of knock that down. And I think that makes it worse. I think that just drives that deeper and, is almost like pouring gas on the fire. Is that things that you've seen people come in with that they've been mistreated for other things and unfortunately has made that worse? Has that happened in the past for you?
Yeah, like, patients that have gone to hospital and they have like Lyme symptoms, a big bullseye rash, and it's called dermatitis or something else. And one of the reasons is that I have a colleague of mine. He's no longer practicing in Maryland. He had a Lyme practice, and he had 9 medical board reviews. And he said, most of the complaints against me on for the medical board weren't from patients, they were from insurance companies because they didn't want to pay for the treatments, according to him. So he's now said, I had enough. I don't want to fight this anymore. So he's now in Florida.
Wow, that's sad. In your opinion, in your view, what are some conditions out there that you think are often misdiagnosed? That they're really Lyme, they're really maybe a co-infection, but they're diagnosed with another condition. What are some of the mismanaged conditions out there, you think?
So we see patients who've been diagnosed with fibromyalgia, chronic fatigue, MS, Parkinson's, uh, rheumatoid arthritis, lupus, he got one woman, she was diagnosed with, what is it? She had some unusual autoimmune reaction in her gut. And so when we do an advanced scan on her, we found, oh, you have this protozoa in your gut, and it's been in there for like over 20 years. And she goes like, oh my gosh, I've been sick for like decades. So yeah, a lot of the patients, because if they get tests for Lyme, the tests aren't that accurate. They're only like 50% accurate. The standard tests, you have to go to more specialty labs. And there's also the things called co-infections that ticks can carry that are bacteria, viruses, protozoa, parasites that you can get from a tiny tick bite. So those most likely aren't tested for, but they may be causing the symptoms that look like Lyme. So.
Yeah, absolutely. And I think that's so common. Let's talk testing for a second because you brought it up. And, I've heard some pretty sad numbers. You just said 50% accurate. I've heard other numbers. I remember hearing 30% accurate, that 70% of the time they were giving you the wrong result, whether that was a false negative or a false positive. So that wasn't a good, that's not a great test. In your opinion, what is the best way to test for Lyme or one of the co-infections and feel pretty confident that you're going down the right road?
So we use something called an advanced scan, and that uses electrical frequencies to scan for uh, the different infections. Would be Lyme or Bartonella or Babesia or some of the other co-infections, and also scanning for other things like parasites and viruses like EBV and things like that, mold. And that is what we use as kind of a first pass to determine, does a person need follow up for their like blood test verification? But at least it's on our radar to say, hey, we
Hmm.
think you have this parasite or you have this co-infection, and that you can try doing parasite testing for it, or co-infection testing, but don't hold your breath, because according to the statistics, it's only 50% or 30% accurate, the blood test. So from us, we found, because we have, where I am, there's like 40 different Lyme litter practitioners, and most of their strategy is kill the infection. So they blast them with antibiotics, and or herbals and things like that. And the patients, some do really well with that. Others, the ones that come to us and they say, like, it's too much for me. And so we need to understand how to detox them, how to get the inflammation down, how to rebuild their system before we do heavy killing, because they've got too much junk in the trunk and they need to get the junk out.
Yeah, if you got a big booty, you got to take care of that first before. No, I'm just kidding. But I totally agree. And one of the things that I talk about so often is killing the bug. It does not solve the problem. And I think that so often people are under the misconception that their only issue is just the bug, and that's it. But you've already mentioned so many other factors that could be at play, including, genetic issues that you might need to work on a little bit beforehand, including, gut issues, including, so many other factors that are at play there. In your opinion, when someone does go a traditional route and maybe does antibiotics or maybe does it could be a natural protocol, but like you said, they use herbs to guns ablaze and go kill the bug. What things can happen, and what are the shortfalls of an approach like that?
In different research studies, when you expose Lyme to certain antibiotics, it produced like little dormant stealth forms called cysts. It also produced things, slimy shields called biofilms to hide in. And that makes it much more resistant, like sometimes 100 times more resistant to antibiotics, the immune system, things like that, natural remedies. So part of the strategy in like getting as much out of patients is not only going after the ones that are kind of in the adult size or normal size ones, but also the little stealthy forms. So using specialized remedies that, when the person's ready, say, often when we go after these special forms, they have a huge flare up of symptoms. And in order to make sure it's not doesn't stay, they give additional detox, additional draining of inflammation, using things like they have patients inhale hydrogen and oxygen together, and that lowers inflammation in the brain really quickly. And people are like, oh, wow, my brain's so much clearer. Or we use electrical frequencies in something called frequency specific microcurrent, where we can target like the liver, which is one of the main detox organs, to say, and clear the bacterial toxins out of there or lower the inflammation in there, so we can help patients to neutralize whatever's being dumped after they kill their infections faster, so they don't suffer after their antimicrobials. So it's kind of like understanding like the dynamics of how to support the whole system with energy and getting stuff out, and being able to fight these infections more sustainably and so they have better results that last longer.
Yeah, I think that is a powerful thing. If your terrain is messed up, if your body's in a weakened state, if you're toxic, if you've got all this other, like as you mentioned, junk in the trunk, then quote unquote, killing the bug, it's probably going to come back. It may be a month, it may be a few months, it may be a year or a couple years down later, down the road. But when your body's in a weakened state, I feel like it can just come right back and flare right back up. And so I love the approach that you're taking, where you're working on getting stuff out of the body and minimizing some of the inflammation and some of the ways that it can spread and hide, so you can be more effective. I think that's such a powerful approach. One of the things that you mentioned was molecular hydrogen. If you would tell us, first of all, what is molecular hydrogen? Why is that such a powerful adjunctive therapy to what you're doing? And what are the best ways to administer that molecular hydrogen?
So it's been a game changer for patients with brain fog, neurological swelling in their brain, in their, meninges, like meningitis or something like that. And we have patients inhale it through a nasal cannula, and that goes right into the brain. And in multiple studies, lowers inflammation quickly. It calms the nervous system, lowers anxiety, and helps with sleep, because that's another issue is a lot of patients have difficulty sleeping because their brain is too overstimulated. So you get the inflammation down, you get the toxins down. It's also helpful for mold toxins in one study. Hydrogen can help with that. And so these patients then, I mean, I take it at night to help me to just chill out from the day and not, thinking about patients all night. It just helps calm my whole system down and help me get into a deeper restorative sleep. And that's huge because when we see like patients wearing like their wearables, whether it be their watches or their rings, that when they do the hydrogen, they have much better, deeper sleep states. So,
That's great.
yeah.
So you use the breathable form. Are there other forms that can be valuable, and other forms that can be used? And if you would put them in a hierarchy for us, like what's the most potent and the next most potent, and if you would.
Yeah, I had another patient. She had tick co-infection. She had a really bad hand pain, and because some of the infections do affect the extremities, like Bartonella, and nothing was touching it. No medications, no topicals, no whatever it was, lotions, and it was preventing her from sleeping. It was so bad, and put the hydrogen on it topically through a funnel, and within 20, 30 seconds, she goes like, the pain's gone. How did you do that? And it's been a game changer for just applying it topically on, it could be a joint. For men with prostate issues, they can put it right, up there. And that hydrogen will go right through the clothes, right into through the skin, into the prostate, and lower inflammation quickly. Also with urinary tract infection patients, putting it over the bladder, getting in there. That just has become a game changer. And then we also infuse it in water, and then we drink it in the office during the day. I had another patient. She had a chronic parasitic infection. She went to her mother, took her to all these like top doctors who deal with parasites, and she was still sick after over a decade. And so she got a hydrogen unit. She started drinking the water. And I learned afterwards, she goes like, I can't believe I have so much energy. I can't sleep. And normally I'm sleeping 14 hours a day.
Whoa.
And instead of like chasing treatments now, she's now a healthcare provider in Australia.
Oh, that's
So
great. I love
yeah.
that.
So breathe it, drink it, topical, you know, those are the main ways that we use it. And it really depends on what's going on in the patient and what would be most effective for helping them.
Yeah, I think it can be such a powerful thing to add into almost anything you're doing. I mean, you're basically just supplying your body with what it needs to move electrons, and I think that's such a powerful thing to do on a cellular level. I love the hydrogen therapy, and I love that you're implementing it and helping people with Lyme, using it in such a powerful way.
Yeah,
If
and
you
just put I'll give you a link to what the machine that we use. You can put it in the show notes, so that would be helpful for
Yeah,
listeners.
I will definitely do that for anyone that is interested in the type of machine that Greg is using with his patients. I'll definitely do that. Digging in just a little bit into the body, what areas of the body does Lyme love to live, and what does it love to affect? And what are some of the differences in the places that it can live and infect?
Now, different species of Lyme, there's multiple species of Lyme, they can manifest sometimes as more joint pain because some of them like to eat cartilage,
Hmm.
or they can produce nerve pain because some of them like what's called the sheath around the nerves called myelin. To them, they like that more as food. So we get patients more with like migrating nerve pain, or if it's advanced, could be like MS, like diagnoses, or chronic pain, relapsing pain syndromes, burning pain, like electrical wire, sciatica pain, things like that. And other ones have more of a neurological manifestation where you have more like tremors or insomnia, brain fog, cognitive issues, where they're really inflaming the nervous system and then making infections and biofilm problems in the brain. So it depends. And sometimes we do get patients from Europe. So we'll do the scan on them and we'll find that they have European strains of Lyme, things like I think Borrelia afzelii is one of the ones that we see in more in those patients, and they tend to have a more of a chronic fatigue presentation. So yeah.
Yeah, I think just listening to what you said, I'm hoping people are getting an understanding of the broad spectrum of possibilities of where symptoms could arise. And I hope you're starting to get an understanding of how so many different conditions out there could be diagnosed as other conditions. And as you mentioned, everything from fibromyalgia to chronic fatigue syndrome to multiple sclerosis, Parkinson's, things like that, and a lot more. And so if you're struggling with one of those issues and you just feel like, okay, there's something else going on, I would highly recommend you find somebody like Greg or somebody that can do some of this advanced testing and maybe help you figure out if there's something else at play, something under the surface that's not being picked up by traditional testing that maybe you could make progress with, because there's so much help out there for you. There's a lot of people like Greg out there that are offering so many different types of natural therapies that are safe and very effective in ways of helping in so many different conditions and so many different situations. I think a lot of people don't really understand about Lyme co-infections and some of the other the good buddies that go along with Lyme. What are some of the most common ones that you see where you're at, and what are some of the symptoms or issues that go along with Lyme's buddies that he likes to bring to the party?
So Bartonella is one of the more common ones, and we see burning symptoms, anxiety, panic attacks. We see like extremity, like redness, pain, neuropathy, nerve pain in the hands and feet, often in that infection. There's another one called Babesia, which is a protozoa. It's like malaria. And you often get shortness of breath symptoms. You get headache that's like a cap too tight on your head, squeezing it. You get anemia because it destroys red blood cells. You can get like spleen and liver problems because unfortunately as it's going to the blood, it then can lodge in those organs and infect those and create inflammation in those, and then you have poor detoxification as a result. We're also seeing increased something called anaplasmosis, which also you can see as neurological infection symptoms where patients have like headaches, they have like disorientation, other infections that we see from the scan. We do see something called Ehrlichia also, but not as much. And that's another bacteria that can cause like um, unusual swelling in the body. It can create also neurological symptoms similar to anaplasmosis. There's another one called brucellosis, which has a unique symptom where your sweat smells like wet hay. And yeah, because it likes to infect the lymphatic system and create its, whatever it does to create that changes the body's when it secretes out the pores. So your sweat smells different.
It's very difficult. If you live down south in some of the higher humidity areas and you do hay, I mean, good luck getting diagnosed. I mean, it's going to be pretty tricky because you already smell like wet hay to begin with. I mean, that's going to be hard. So,
Yeah. So that's why you need some sort of advanced scan testing that can help you find these things because most regularly trained medical providers, they're not going to test for the co-infections. They mainly just test for Lyme. So
yep, I agree. Uh, I know at this point people are like chomping at the bit. Like, okay, we've talked about testing, we've talked about some of the therapies that maybe help me not feel as bad. How do I fix it? How do I fix my Lyme? How do I fix my brucellosis or my babesia or my ehrlichiosis or whatever condition, co-infection might be there? What's your process look like? And what do you think are some of the most important factors to do first, second, third?
So we do an advanced scan on patients first to see what are we dealing with, because and working with over 1,000 patients, no two patients are alike. Some have Lyme and Epstein-Barr, some have Lyme and mold, others have Bartonella and parasites, and so it's you know even if they do have the same infections, they detox differently. They have different genetic issues and all these other factors that come into play. So based on the scan results, we can actually test in the scan what happens when we try this antimicrobial herb or essential oil or supplement, and then we get a sense of like, okay, this is the customized treatments, remedies that can really help this person get better faster because we're addressing the underlying infections, toxins, detox blocks, genetic issues, and helping the patient to then really rebuild themselves, not just kill the infection, because many of our patients are depleted. They have mitochondrial energy, cellular energy depletion, so their cells are tired, or their adrenals are, fatigued, and they can't, they have low back pain, or they crash at 3, 4 o'clock in the afternoon. And so they need energy to heal because it's very hard to detox. It's very hard to fight infection if your body is out of gas. So we need to put the gas in the tank, get them energized, lower their pain, calm their nervous system, help their painful emotions and reducing those. And then once all that stuff and they can get stuff out, then we can start killing their infections more aggressively because they can dump the stuff out of their body. They're not like, oh, all of a sudden like stuck with a bunch of toxins that are causing problems. That they can do saunas, they can do enemas, coffee enemas, they can do dry brushing, they can do topical castor oil packs, all sorts of binders like charcoal and clays or citrus pectin, zeolite, things like that. And based on that, then they can start to take the layers off of their symptom, of their illnesses, of their infections. And as they do that, then they have more energy. Their brain works better. They have less joint pain. They can go to work more. They can be a parent better, or all these things.
Yeah,
So
I love your approach. I think we're along the same wavelength. No two cases are exactly the same, and making sure that the body is ready to do the deep work and taking things down layer by layer is so important. I think early on, especially with my wife, that was something we weren't aware of. That was something that we had no idea about, and I think we crashed a lot of people out. We crashed her out. I think just
oh,
trying
I'm
to
sorry.
it's a learning curve, right? But the funerals were nice. There was some good funerals there for some of the people that didn't survive the Herc rations. I'm kidding. There was no funerals. Everybody's fine. Everybody lived. Uh, but yeah, when you go after the deepest layer too quickly and your body's not ready, you can crash out. There's a reason why something was able to thrive in an environment like that to begin with, and usually there's layers of other stuff going on, and so that's such an important factor. And I agree, it's not no two people are exactly the same. So besides the molecular hydrogen, you mentioned, a microcurrent. Can you tell us a little bit about that technology and how you're using it and how it actually works?
So, frequency specific microcurrent uses two electrical frequencies. The first one is a healing frequency that says kill Lyme, detox toxins, lower inflammation, increase healing, regeneration, and so you can then combine that with a location frequency and that says the liver, the midbrain, the eyeballs, the skin, the blood cells. And so then you have this really super targeted treatment that you can direct throughout the body. And based upon the scan results, we can get a sense of like you really have a gut infection with parasites, or you have Borrelia that's in your nervous system or Lyme in your nervous system. So we're going to direct the frequency treatments to detox those areas first, get the inflammation down, and then we'll try some of the killing stuff and see how you do. But immediately after the killing stuff, we're going to detox it and drain the inflammation and right afterwards. So it's not going to hit your system with all this stuff all at once, but we're going to mop it up as we go along. So that's how we use microcurrent frequencies. Basically, we put wet towels, and the frequencies are delivered through wet towels on patients, or you can do it through like sticky pads, like you see with a TENS
Mhm.
unit. And the box is, it's about, yay big. And we have three, actually, when patients come in, we'll have as many as 3 units on doing 3 different treatments, like for the brain, the gut, detoxing, inflammation, rebuilding energy. Because that's another thing, to have a increased vitality frequency that you can send into the adrenals, into the blood cells, into the brain regions. And so it's been a game changer for patients that, have multiple issues that no one's figured out, or, it just helps so much healing faster.
Yeah, I love that. I think we used kind of a similar type of device, and we had some interesting results with that. And it's a little weird, to be honest. You're putting on these little electrodes and you're putting current into people, and things are changing. And I think in a lot of people's mind, there's a disconnect there. Like, well, how's this little battery powered machine, or how's this little electrical machine zapping me and doing anything to my body? But as you mentioned, the frequencies can be very powerful in generating response, whether that's vitality. I like the sound of that one. That sounds really good. Or generating, some other type of healing response. And so I think those type of therapies can be so powerful and so good. In terms of timeline, and I know different cases can be different, but how long does it take working with somebody that may have been dealing with Lyme to see some changes? And then how long does it usually take to see some results? And then in your opinion, do you feel like you can, eliminate Lyme or totally get rid of Lyme? Sorry, a lot of questions there.
So, uh, I had a patient a couple years ago. He went to the top medical institution, which is only about an hour away from here, over a decade, over 35 times. And they gave him multiple diagnoses, multiple medications, multiple treatments, and he would get sicker, a little better, and sicker, sicker, and sicker. And he got to the point where he couldn't even, he said, I can't even add 2 numbers in my head, and I'm responsible for the operations of my company.
Yeah.
And he told his wife, I can't do this anymore. I don't know what to do. I just want to give up. And she goes like, well, before you give up, let's try this other place called the Lyme Research and Healing Center. So he comes in and he's like, has chronic fatigue. He's got severe neck and joint pain. He's depressed. He has suicidal thoughts. He's really struggling. Normally he would get up normally 5 a.m. and he's sleeping in till like 11,
Whoa.
12 in the morning because his fatigue is so bad. And so when we scanned him, we found three things that the top medical institution missed. He had mold in his sinus system called aspergillus. He had a gut infection called Clostridia, which is a bacterial infection. He had a tick-borne infection called brucellosis, which is another bacteria, and which makes his sweat smell like wet hay. So when we started treating these using herbs, essential oils, supplements, homeopathic remedies, he began to have die-off reactions. So he was dumping more toxins and inflammation. And so we would run different things. He would inhale the hydrogen that would help clear his brain. He would take the microcurrent and put a towel on his neck, towel on his feet, detox and drain his whole body. And one of the game-changing treatments for him, because he also had, when people have a lot of toxins over time from infections, their blood gets thicker. It gets
Mm.
more coagulated. So it creates something called hypercoagulation. In Chinese medicine, they call it stagnant blood. So one of the main ways of getting stagnant blood out of the body is something called cupping and bloodletting. We're actually putting suction cups on. It draws all this gunk to the surface of the skin. Then you take the cup off, you needle it, you put it on again, and it draws out this thick, dark, red stuff that doesn't look like normal blood. And then when you take the cup off, normal blood kind of runs around and flows everywhere. And this guy, it sat there like a jello blob. And we did it on his neck where he had all this stiffness and pain on his shoulders, behind his liver to get stuff out of his liver. And all of it came out like dark cherry jello. And at first it freaked him out. But afterwards, when he got up after the treatment, he's like, oh my gosh, I can turn my neck for the first time like this, and there's much less pain. And, plus it also drains inflammation and toxins in different research studies when they've analyzed in a lab. It's high in toxins, high in inflammation, high in all these other stuff. And so he's like, wow, that was amazing. And so we did that on him. He lives local to us. So he would come back weekly and get this treatment and then keep more and more of he got pulled out, the more his blood looked more normal over time. And so at the 2-month mark of treatment, he comes into treatment and he goes like, oh, I just drove my daughter to college. Before he wasn't driving when he came to
Wow.
us. And so I said, okay, great. Where's the college? Colorado. I went like, you drove to Colorado? Are you nuts? It's like, yeah. Did you stop overnight? No, I just drove it straight. I used to, like whatever, 18-hour trip or 12-hour trip. I'm like, dude, man, you're hardcore. What's going on? And he's like, yeah, I'm feeling that much better. I'm like, well, I'm glad you're feeling better, but take care. It's like, yeah, he wasn't concerned. And so at the 4-month mark, he goes like, my pain's gone, my energy's back, my brain is working. I can do the books in my head. And he goes, you saved my life, and you can give people my name and number, and I'll tell them what you did. And at the 5th month mark, he goes like, I'm going to take my wife to Alaska on a cruise for the first time in many years, and she's really happy about that. So
That's
that's
amazing.
kind of like a really good case scenario because we could pick up what are the biggest issues. He also had long COVID because that also thickens the blood. So we gave him enzymes also between the cupping sessions to break down the thick blood. He got something called nattokinase to help with that.
That's
So, and I
great.
talked to him like a month ago, and he goes because I said, hey, I got somebody who wants to talk to somebody. He goes like, sure. I said, how you doing? I'm doing great. And this is like 3-4 years later. So, and he hasn't been in for treatment or taking remedies since then.
Love that. Love hearing great results like that. And it's so amazing the techniques that you used and just a variety of things. It wasn't one thing, it's a variety of things. And that's what I think that people need to understand is it's not one supplement. It's not, one therapy that's going to fix you. There's going to be a variety. There's going to be probably, a small amount of, we'll say trial and error, but, just figuring out what are the most important factors and the most important things for you. And I think that's just so important to understand. You mentioned that he had mold in his sinuses, and I think that
Yes.
is something that people aren't aware of. Talk me through a little bit about, first of all, mold can live in your body and stay in there. And then, second of all, are there any other areas of the body that mold can live or likes to live? And if somebody did have mold in some of those areas, what are some of your favorite therapies to try to help detox that and get the mold out?
So I have another patient. She's had a chronic fungal infection probably over a decade, and she actually contacted us 12 years ago and says, I'm thinking of coming here for treatment, and nah, I'm not going to come. And then 12 years later, she's like, okay, I need to come in because all the other things have none cleared this fungal infection I have. She has Lyme and other things too. And so we scanned her. We found, oh, you have this other kind of fungal infection, environmental fungal infection. It's in her sinuses, it's in her skin, it's in her intestines. So basically, it's pretty systemic. And so one of the treatments that we were giving her are anti-mold essential oils and like in a carrier oil. And she was taking those. She was taking some homeopathics for mold, detox and drainage, but it wasn't really doing much. The fungal infection wasn't being knocked down. And so he said, okay, we need to go more aggressively. Are you ready for that? Can you detox? He goes, yeah, I'm up for it. So she ends up buying a frequency specific microcurrent unit, and we program it with a 6-hour program to clear fungal infections out of her sinuses, her skin, her body, her intestines. And she would run that at night when she slept. She also got a hydrogen device and inhaled the hydrogen because that helps lower mycotoxins in research studies. We also made what's called nanoparticle remedies of the essential oils because the fungi can like get their roots, or they call hyphae, go into between the cells. They're kind of like roots of a tree. And you need to get stuff deep in there. So the nanoparticle essential oils we gave her had antifungal properties. We also made one made out of garlic oil. And when you take it, you smell like a garlic bomb. And because the other patients have like, all my colleagues at work, they don't like it when I take my garlic oil because they're like, oh, Dracula hates you, or, you stink. Get away from me. And so, but it's highly antifungal and anti-Lyme and anti-co-infection. So we put that in, and it gets deeper into the cells, deeper into the brain, deeper into the gut to clear out these infections, fungal mold issues. And so she reported back to me after being on the essential oils, doing the microcurrent, the hydrogen
Hmm.
combination, that my fungal numbers are much better. And at the 3-month mark, she goes like, my fungal blood is normal.
That's
So
fantastic.
one of the other things she did was something called a nasoneb. This is like a power washer for your sinuses. Like you've heard like a neti pot or other things like that where people just kind of dribble stuff in their sinuses. It doesn't get to the rear sinuses. The nasoneb shoots out this 3 to 4 foot long mist that like really like power washes things, not only the frontal, but also the other sinuses. And so when people do it, all this gunk comes rushing out. Like people talk about like 6-inch long, like snot coming out, or, all these, stuff. And this is like a game changer for patients that have these chronic sinus infections, or everything they've tried isn't clearing or helping their Lyme get better because these hidden infections produce toxins, and those toxins leak into the brain, and that prevents the immune system from working as effectively. So we need to address that at some point in a patient's healing process.
Yes, I totally agree. And we have seen just slightly different methods, but yeah, we've seen some interesting things come out of people's faces. And we've also seen that when you do have something stuck there, it can really prevent or slow progress. But when you get it out, it's almost like people can reach a new level, and that's a powerful thing to do. And so that's exciting to hear about the results. But I think people sometimes are a little afraid of like what might come out of their face, what comes out of their nose and everything. But better out than in, right? That stuff was living in you, and it was in there
That's what
causing
Shrek
trouble.
says. Better out
Yeah.
than in.
Better, yeah, absolutely. We're coming up on the end of our time here together, but I just wanted to say thank you so much for taking the time to share so much knowledge and expertise. And I love hearing how you're working with patients and how you're helping so many people with such a difficult and misunderstood condition. If people wanted to learn more about you, if they wanted to learn more about your work, where could they go to find out about that?
So we're on the web at lymeresearchcenter.com, Lyme researchcenter.com. And we're also on Facebook. We're also on LinkedIn, Instagram, and also we're preparing a free video for listeners for this podcast. And we're going to put that at lymeresearchcenter.com/discover, all in caps. So, and you can get more information on what's helped these patients who have this Lyme that's not improving. I'll talk more about what helped the different case studies, like molecular hydrogen and microcurrent and essential oils that are really helping get patients better more quickly. So I'll happy to put that out for you all, for your listeners.
That's great. Thank you so much for coming on. And again, just thank you for the work that you're doing. And thank you for sharing with us.
Well, it's been great. I really enjoyed talking with you.
Me too. Thanks for tuning in to the Discover Health podcast. Remember, your health is a journey, not a destination. Keep exploring, and we'll see you next week.